Dear Professor Goldemont, dear colleagues, it's a pleasure to be invited to present in front of you at the Gestein Healthcare Forum. My name is Alex Simidchiev. I'm a physician. Also, since about a year and a half ago, I went into politics in my native country, Bulgaria. One of the elements which I'd like to share with you is how important it is for the environment to be relatively stable as we try to reform healthcare, and we must take specific steps to increase stability both in the environment and within the healthcare system so that all active interventions can be precisely measured and actively affected. Thank you for giving me the 15 to 20 minutes I need to share my view with you, and I look forward to your comments. This is the presentation, Healthcare Stability in a VUCA. First of all, a few words on what VUCA is. VUCA is volatility, which is fast and predictable changes without a clear pattern or trend. The U is the uncertainty with frequent disruptive changes. The C is the complexity with intertwined technological, societal, and geopolitical and ecological evolutions. And the A is ambiguity, which means actually lack of clarity on what is real or true and difficult to predict the impact of actions or initiatives. We actually live in a VUCA world, especially after the initiation of the aggressive war in Ukraine. Now, a couple of words on Bulgaria's healthcare. An overburdened and burned out healthcare system, mainly due in the last couple of years to the COVID pandemic, which was not controlled well from a political standpoint. Also an underfunded and overworked healthcare workforce. Not to pass the fact that the population has never really taken care of their own health care, since there is no widespread public health messaging or communications. And you can see that, for example, the last time of a visit to a dentist is for more than half of the population is over a year or longer, and a third or more of the population don't see their GP over the course of a year. So healthcare is not really well functioning. And on top of that, there are a lot of factors, external factors, which cause instability. Now, I've tried to partition out the key elements of instability in factors which I have divided into external instabilities, mainly related to technology and information and communication, and internal instabilities, which are political, social, and economic instabilities specific to our country. The technological instability is a fact. It has been measured, and overall through the whole of industry, we can see that from the 2016 onwards, disruptive technologies have added to the level of instability of the technology system as a whole. For healthcare, I believe this index is even higher than the one depicted here, which is overall technology, but you can see the magnitude of change over the last 5 or 6 years, and it is very serious. From the point of view of information stability, it is probably very similar to the graph you just saw on the previous slide, but the fact is that it has a dramatic effect on healthcare. Here you can see the level of COVID death in a specific country related to the level of media literacy. And they seem to be really well correlated. Bulgaria being on the top of this graph with the lowest level of media literacy and the highest COVID death rate, and Finland on the other end with the highest level of media literacy, of the population and the lowest COVID death rate. Of course, it's not only the media literacy, it's also other factors of the social environment, but this ultimately, you can see the pattern of decreasing COVID death rate by increasing media literacy. Fake news has become so prevalent and so disruptive in all our societies that it is a key instability that needs to be managed on a global scale, but also internally in each of the countries. From the standpoint of political instability in Bulgaria, about a year and a half ago, I decided to go into politics. I was invited in one of the parties to enter parliament, and I participated in the parliamentary elections on the 4th of April in 2021, which was the elections for the 45th parliament. That didn't last very long. On the 11th of July, I again applied for the next parliament since the previous one was dissolved and it couldn't actually formulate a national government. So we had a second election on the 11th of July in 2021. Several months later, on the 14th of November, we had the third parliamentary election for the 47th parliament. And as you probably guessed it, I am currently applying for the next parliament. The election will be on the 2nd of October this year, and that will be for the 48th parliament. So you can see we can all participate in the Guinness Book of World Records with a number of parliaments per year, going to very high numbers, and parliaments being changed every 3-4 months, which leads to an extreme level of political instability. The current parliament, there are 29 parties as candidates for election. That's the full spectrum from far right to far left, with everything in between. Currently, according to sociological research, 8 are expected to pass the entry barrier of 4%, which means, again, a very fragmented parliament with 8 political parties inside and none to be able to achieve a majority by itself or even in a double coalition. That in itself leads to a significant amount of social instability. But the social instability has other factors which contribute to it. One of which is the demography. A very low birth rate with a very high death rate. So the demography of the population is a very aging population. Processes of urbanization are quite significant, with almost a third of the population living in the capital of Sofia. Also, the stability of the family unit is not very high, with these are numbers for 2021, 26,000 marriages and 10,000 divorces, which is a rate of 38% of divorce rate, which gives you the fact that family is not a very stable social unit. Education is not really good, with a PISA score of 426, which is 13% lower than the OECD average. And you can see that over the past several years, the PISA score has been decreasing, both for reading, mathematics, and science. So the population is generally becoming less well educated. On top of that, there is a decline and a very low level of people having read a book in the last year. That's only 46.9%. Almost half of the population have not read a book in the past year. And this is also compounded by the fact that the Gini index, which is the index of financial equality, is really low. Actually, it's 40.3, which is the lowest. Together with Turkey, it's the lowest in the whole of Europe. So we have a very high level of economic inequality, together with decreasing education of the population, an instability of the family unit, and an aging population, all of which leads to a significant amount of social instability fueled by the political instability. The economic instability, especially after the start of the Ukraine war, is also very significant. with Bulgaria being one of the countries with a very low GDP per capita. And when you have a low GDP per capita, all external events impact economic stability to a very significant amount. For example, inflation rate in Germany is a single-digit one, a high but single-digit one. In Bulgaria, it's a double-digit inflation rate in the high teens, even about 20% per annum. The government consolidated gross debt is about 14 billion euros, and you can see that with the GDP, actually it's a debt which will be difficult to resolve in the near term, so that adds to the economic instability. The consumer price index since 1995 has a cumulative percentage of 8,702%. And the last year only, the inflation rate is about 20%, driven mainly by fuel and heating and energy costs. A lot of crisis events which add to the level of instability, both from the government perspective but also from the societal perspective, with more than 100 floods, 754 fires and 24 landslides. Now, if we list all of these instabilities and how they impact the healthcare, I have tried to assess on a personal intuitive level the current state of affairs of each of these factors and how much they impact the overall stability of the system. For me, the political instability together with the economic instability are key elements of the instability of the healthcare system. The technological instability, although important, is not such a high contributor. Now, how I would expect to evolve these external instabilities over time is that I would expect the technological instability to lead to informational instability and also to lead to economic instability as new technologies come on board in healthcare. The economic instability leads to societal instability because the low level of GDP and the high economic instability actually destabilize the social structure, given that the Gini index is so high. And the social instability and the political instability interact on a two-sided mode. So social instability leads to political instability and political instability leads to social instability. So you can see that all of these are quite connected. Both the external factors and the internal factors lead to a high level of instability. Where I would expect the desired state to be in a year and a half to 2 years, if we do the right things, is that most of these parameters can be stabilized, with the most important being social stability, because that lends a very strong foundation for good healthcare. But the fact is that technological stability cannot be managed very effectively on a national level. It can be managed externally, and the way we can manage the information stability and the technological stability is by public information campaigns and opinion research, which guides the campaigns which need to be done both for the technological upgrade of society as well as the information literacy. That requires a significant amount of resources which are currently not being used, and so that level of instability, the external ones, remain really high and impact the internal instabilities. The political instability is something which can be actively managed, and one of the ideas that I have been trying to push for the last 3 parliaments is to create something called a medical council. A council of expert medics which are affiliated to the parliament. They're not elected, they're incumbents, which have a term of office which is longer than a single parliament. For example, our parliaments are 4-year-old parliaments. Their mandate is 4 years, And the medical council I envisage as something which has a term of 5 or 6 years, which actually bridges between parliaments and leads to a structure, a senior structure in the legislative branch of government, which would allow a lot of the strategic input to remain in place after a parliament dissolves. In times of parliamentary crisis like this one, it would be one of the few elements that can keep strategic imperatives in healthcare continuous in between changing parliaments. And also the seniority of this council would add stability to the executive branch of government too. Social instability being a function of politics and economics as well as external factors is something that we need to watch and try to model according to the opinion research and public information campaigns, while economic instability can be managed both by a watch and wait, but also actively by something which we call financial reorganization, which would reset the stimuli in healthcare in 3 buckets. One would be funded by taxes, and that would be the business model around preventative care. The National Health Insurance Fund, which is a communal fund, would be caring for the chronic diseases, and insurance-based financing would be for additional activities which people can do for themselves, additionally on top of the currently mandatory National Health Insurance Fund. The social stability can be managed really well by the digitalization of healthcare, because that gives a level of transparency which reduces the level of anxiety in people, because they can see what has been done for them and to them in the system, and it gives a level of control on personal health records, which I believe will be very important for the stabilization of the social structure of healthcare. Now, we said at the beginning that we live in a VUCA world. We have a Bulgarian saying which says that you need to take, if you have a stuck wedge, you need a second wedge to get the first one unstuck. So the saying is clean is biva, which means that it takes a wedge to take out a stuck wedge. So for the VUCA environment, we need to use another acronym again for VUCA. For the volatility, we need a vision. In uncertain times, a vision which can be offered by the Health Council within the Parliament is an important element to reduce the volatility and to give a clear vision of where we want to go for healthcare. For the uncertainty, we need to deepen the understanding, and selection of the people who would go into this council is an important element. If they're people of high repute, also if they understand the functioning of the local healthcare system really well, that level of understanding can reduce the uncertainty for future activities and for them to guide a strategy which will improve healthcare overall. For the complexity, we need clarity on the few elements that can be managed well. And for the ambiguity, we need agility. Agility is actually important for the volatility and for the uncertainty too. We need to be quick in adapting our strategy based on the changing world, both internally and externally. I'd like to thank you for listening to this presentation, and I look forward to your contacts.